What happens when families can no longer support their children? In the world of foster care, some of the most complex and least understood decisions happen behind the scenes where stability, safety, and survival collide. Let's welcome Margie Barilla, founder and CEO of Barilla Consulting. Happy to have you here with us, Margie. The story that sort of prompted this is so sad. There's some statistics out that show thousands of parents are giving their kids up because of mental health issues, addiction issues. What is going on right now in families across America?
Absolutely. So we have seen a significant number of children displaced in foster care. We are currently seeing over 100,000 children daily in the US foster care system. It's been very heart-wrenching because not only while they're under the care of foster care or even under CPS or DCYF, the challenge that we're finding is that even when they're aging out, what happens? And so took a step back, really dug deep into the situation. How do we help them from the age of 5 through 17 and then midnight up to the age of 19? So we have amazing programs nationwide that we have implemented since November 23, that I would love to go more in depth with you
Yeah.
guys to see the data that we're collecting from all this.
Absolutely, yeah, because it really takes all the partners working together to make sure that these children are placed in the proper homes. But when
Correct.
we are going back and talking about the relinquishment part, what does that actually mean within the foster care system, and who makes that decision?
So a parent has the right to contact or go to a local police department or to a safe zone and pretty much share we no longer want our child. They can go to an emergency room, they can contact a foster care placement agency. They have various avenues to do so. We are on the receiving part. I was able to get a bunch of people that really are passionate about the foster care system here in the United States. Every resource we are creating is actually staying within the United States.
Oh,
So
okay.
we get the phone call. We have a client that has been sexually assaulted, have been raped, have been sexually abused, right?
Hmm.
Just any kind of facet, or they're dealing with suicide ideation, depression. And that's when we do our initial mental health screening, our intake assessment. We're able to place them for long term. So a child can come to us at the age of 5
Hmm.
and literally stay until 17 if
Wow.
there is no early intervention or prevention
Hmm.
or even reunification or permanent placement.
I had mentioned a couple of them earlier, but what are some of the most common reasons for relinquishment today?
It's going to have to be behavioral issues.
Behavioral issues, really,
That's what we're
of the children or
anger.
of the parents?
It's actually the child. They're unable to get them to be stabilized in the home, having them accountable. If the parent asks, "Can you do this
Hmm.
XYZ chore?" The child becomes belligerent.
Yeah.
The parent just is exhausted,
Hmm.
and or the child is continuing to cut.
Oh,
They
yeah.
don't know what to
Yeah,
do,
sure.
or maybe they're drinking items, household items, because they're going through depression.
Hmm.
So it can be a lot of facets, but mainly right now we're seeing is behavioral issues
Yeah.
where it's leading to suicide
Oh,
ideation and
gosh.
depression.
And these kids, what doesn't work in their own home isn't necessarily going to work in other homes. So they're getting shuttled from place to place to place. Under what circumstances does that placement break down? And then what does happen to the child next?
So for us in general, we are pretty much, they would complete a free mental health screening that goes into our admissions department. Then we schedule a same day or 24-hour intake assessment. From that point, we can then determine if they would actually meet the needs for long-term care. For us, what makes us different from the rest of them, we, yes, bill for medical insurance based on medical necessity. But say, for instance, you have a CPS worker that brings a child to us. Most times they're stabilized in an emergency room or another temporary facility for 5 to 7 days.
Hmm.
These CPS workers are stuck. So they end up staying inside the CPS worker's car, idling to find a placement or a CPS office, unlicensed facility, or they end up taking them to a hotel.
Hmm. Oh, gosh. And
And how do you eliminate that, right? That's
right,
where we come
exactly.
in.
Yeah. So tell us more about your consulting business.
So what we do is we acquire empty hospitals, hotels, or schools, and we literally convert them into long-term care. Some places they call this as an orphanage, and I'm beginning to believe that's what we are, because we're just because you've been there since age of 5 and we cannot find a home for you, we're not going to ask you to leave. We're going to still do this under room and board. So we are working very aggressively with all the CPS offices across the US. Some are a bit slow, and I'm like, your state is referring out
Yeah.
at least a minimum of 100 kids to other neighboring states.
Oh, wow.
If we keep doing that, there's not going to be a stabilization or consistency in this child's life. Foster care children are actually replaced possibly anywhere from 11 homes or more before they find their forever home.
Gosh.
So imagine you don't get to have a birthday, you don't get to participate in any kind of family, events and such, because you're constantly getting transferred. So that's where we come in. Normally for us, our admissions is within 24 to 48 hours. We are actually getting all the documentation to where medical records.
Okay.
We would actually get a move-in date the third, fourth day.
And one last question I have for you. So if someone's watching that here in South Carolina, they can contact your organization and get the same kind of help?
Absolutely. You can
Okay.
just go on to haventreatmentcenter.com. That's one of our centers
Okay.
in Vancouver, Washington.
Okay.
They have 30 beds. Fulton, Missouri, we're about to have 198 beds there.
Wow.
Austin, Texas, we're going to have about 300 beds.
Okay,
So we're converting these buildings.
There are resources
Oh,
out there for people
absolutely.
here in South Carolina. Okay, very good.
Absolutely.
Margie, thank you so much for coming on and sharing with us.
Thank you.
Appreciate
I do
it.
appreciate it. Thanks. Bye.
We'll be back after this.